what we can do to prevent osteoporosis. So in this video, what I wanted to go through was some details about vitamin D, the other half. First, let's talk about where vitamin D comes from. There's actually 3 different sources that we can get vitamin D from. One source, and probably the best source if you can pull it off, is to get vitamin D from the sunlight. So you know that we all have cholesterol, and probably more cholesterol than we need. So our body can take cholesterol and turn it into vitamin D, given enough sunlight. And how much sunlight do you need? If you go out for about 15 minutes to an hour a day, depending on where you live geographically and what time of year it is, then that's all you need to meet your daily requirements for vitamin D. But of course, if you're slathering on sunscreen, which is a wise thing to do, given how UV light causes cancer and skin damage, then you're not going to get that vitamin D made. So here's a picture of cholesterol, and I'm showing you this because I want you to compare it to the 2 sources that you get from the diet. Okay, so the 2 sources that you can get from the diet are vitamin D2 and vitamin D3. When cholesterol is made from the sunlight, it is naturally converted into vitamin D3. That's the type of vitamin D that our body makes and that's made in the bodies of all animals. And here is what vitamin D3 looks like. You can see that right here versus right here, this is one of the differences between the 2. There's also an opening here in the vitamin D3 that is not present in cholesterol. That's another thing that has to happen chemically. And then when you compare vitamin D3 to vitamin D2, the main difference here is the lack of this double bond and then some additional methyl groups. So there's 2 catalytic steps that have to happen in order for vitamin D2 to become active in activated form. And in fact, what vitamin D2 does is it just goes directly to produce the 25-hydroxy vitamin D3, which is the storage form of vitamin D. So for this reason, vitamin D2 in the diet, this comes from primarily from organisms that are in the fungal kingdom, from mushrooms and from yeast, is how they make it commercially. So if you get vitamin D2 in this form, you have to take 3 times as much of it as you do of the vitamin D3 from animal sources. Okay, I bring this up because this information about the potency of D2 versus D3 is recent. And because vitamin D2 is cheaper to make, that has been the source that has been used by manufacturers for supplementing foods with vitamin D2. So there is now a shift towards using animal sources to make vitamin D3 in the active form so that it will be more potent. So when you're purchasing supplements or when you're looking at how the foods that you're eating are supplemented with vitamin D, you need to make sure that it's vitamin D3 that they are counting for you. Okay. All right, so whatever form you get, whether it's D3, D2, or D3 from the sunlight, ultimately it is converted into a storage form that is stored in your liver and also in the adipose tissues. And this is called calcidiol. So let's go through then how it is that calcidiol is made into calcitriol, which is the active form. So here is skin production or diet gives you the vitamin D, and then the liver converts it into the storage form. And the way that it does that is it adds on a hydroxyl group. So now, because vitamin D had one hydroxyl group already, there are 2 hydroxyl groups, and that's why the storage form of vitamin D is called calcidiol. When it's time to produce vitamin D, then the kidney is activated to produce the enzyme which takes circulating calcidiol from that the liver has sent out and adds on a 3rd hydroxyl group, and that is what makes it calcitriol. So in this schematic here, this is the storage form, 25-hydroxyl, and then 1,25-dihydroxy is the active form. And this is the calcitriol that had the effect that we were talking about in the previous videos. All right, the other thing I wanted to talk about is how vitamin D actually does what it does. So we said that what vitamin D does is it causes the intestine to absorb more calcium than it normally would in the diet. And the way that it does this is because the calcitriol goes into those intestinal cells, and there's a cytosol receptor in the cytosol that binds to vitamin D, calcitriol, and goes into the nucleus and causes the intestinal cell genes to make more messenger RNA of a calcium binding protein here, which is represented by this little wedge. So the net effect is that with calcitriol stimulation, you get more of this calcium binding protein. Because there is this calcium binding protein inside the cytoplasm, the calcium is exported and gets across the intestinal cells from one side to the other more rapidly. And so with a limited amount of time that the food is in your small intestine, if the passage of the calcium from one side to the other is more rapid, the net effect is that more calcium will be entering the bloodstream. All right, the last thing that I wanted to tell you about vitamin D was that there's a lot of buzz going on about vitamin D as a wonder vitamin that does a lot more things than we knew about previously. So there is an ongoing large-scale clinical trial that's being run at Brigham and Women's Hospital up in Boston that's enrolled 20,000 subjects to look at the effect of 2 commonly taken supplements on a whole bunch of different symptoms. They're doing it, diseases, they're doing it simultaneously because that's the most efficient use of limited clinical trials. And what they're doing is taking those 20,000 subjects and assigning them randomly to one of 4 groups. Those that take both vitamin D and fish oil supplements, those that take vitamin D only and think they're taking a fish oil supplement because they give them a placebo that looks like the fish oil supplement, those that are taking fish oil only and are taking a daily vitamin D placebo, and those that are given placebos for both supplements, for vitamin D and fish oil. And as I said, this is a double-blind study, so neither the participants nor the people who are collecting the data know which groups have been assigned to which treatment. So that's what they're doing to them. What are they looking for? They are looking for just about every type of major chronic disease that there's any hint in the literature that vitamin D and or omega-3 fatty acids address. So top on the list is cancer. There is some evidence that people who have a high level of vitamin D in their diet have lower rates of certain types of cancer. Another biggie is the immune system. There is some research that shows that taking vitamin D can help you fight off infections. And in particular, they're looking at the effect on those immune system dysfunctions that are inflammatory in nature, like the autoimmune diseases, and also things like chronic knee pain symptoms. This can come from either issues with the bone itself, or it can also be caused by inflammation. And both vitamin D and also the fish oil, omega-3 fatty acids, are thought to play a role in inflammation.